Okay, the drugs. The reason I added this prologue yesterday to my talk is because of this article I saw in San Francisco Chronicle Thursday. And my wife Terry, the reason I even looked it up, she heard it on the radio. They're recruiting people in San Francisco, University of California, San Francisco, and the San Francisco Department of Health. And it speaks for itself. They're recruiting dark-haired, HIV-negative men and women to take an antiretroviral drug. It's a nucleoside analog. And the purpose is to see if HIV-negative people benefit from taking the anti-HIV drugs. Another purpose is to measure ARVs in the hair to see if people are complying with their ARV drug regimens. So that's very sinister, and this is a good prologue. The reason why they want dark hair is apparently that the dark pigment, the drugs stick to it better, so they can quantify it better. So if anybody wants to volunteer for this program, get right away. There it is.
What about pay here?
I think we're safe. My friend Sam Schlango taught me some Zulu. Iedzink iyanituka, isizwe siyatukwa. Roughly, it translates into, AIDS Incorporated has turned the people into jackasses. There are two AIDS epidemics, which we've heard about already, one for the rich and another for the poor. If you happen to live in the USA and you come down with any of these diseases here and this one non-disease, which we'll have more to talk about in a little bit, and you have antibodies to HIV, the CDC says you are an AIDS case in the United States. Also, as we've heard previously, if you live in Africa, you have a different definition of AIDS, the so-called Bangui definition of AIDS, where the diseases of poverty and malnutrition are mixed together, such as fever, diarrhea, persistent cough, weight loss, and TB, a combination of those, and you can be an AIDS case. It's hard to know, as you can imagine, whether or not, if you're a TB patient, is it old-fashioned TB or is it AIDS? Given these definitions, Sam would like to know, where do you find AIDS in Africa? Do you find it in Cape Town or Durban, or across from Cape Town in Kailicha Township, or north of Pretoria in Soshanguve, or any of the countless shanty towns without names? Medunsa is the largest teaching hospital in southern Africa. This is where Sam worked, and I spent 15 months from March 2005 to July 2006. Medunsa represents anomaly 1. The occupancy rate there is typically 40 to 60%, and there's no AIDS ward. The government is reducing Medunsa in half, cutting it in half to more efficiently realize the occupancy rate of 40 to 60%. Now there is an AIDS ward there, not an AIDS ward, an ARV clinic. It's that tiny little building in that yellow circle. Here's that ARV clinic, and ironically, it was located across the parking lot from Sam's office. Now here's anomaly 2. South Africa is said to have more AIDS than any other country, yet this ARV clinic is closed half the time. One day when it was opened, I went in and took this picture. 2/3 of the people that show up at this little clinic are family and friends. They accompany the sick person. Now, there's no obvious sick person in this particular picture. I have seen really sick people rolled in wheelchairs and carried in there, and the vast majority of people that are there are the ones helping them in out of the transport and in there. But they're not lined up. It's not a waiting list to get in there. You can go, anytime. In fact, like I said, it's closed half the time. I attended the second South African AIDS Conference in Durban in July 2005, and I came across this very interesting thing. When I was strolling down the aisles, the poster aisles, I saw this, a study of 25 of the largest companies in South Africa with ARV programs for at least 2 years and employing a total of 750,000 people, reported that fewer than 1% of the employees that qualified chose to take the antiretroviral drugs, participate in the program. more than 99% of the people chose not to take the antiretroviral drugs. And the authors concluded South Africans are slow on the uptake. Now, South Africans have a much more efficient communication system than the internet. They actually talk to each other. They know what's going on, and they spread the word, and it's very, very efficient. And I laid my hands on this article, The Ugly Side of ARVs. It was published in Nairobi in November of 2005. And here's some quotes from this article. Seen as the key intervention in prolonging the lives of those infected with HIV, antiretroviral drugs are now turning out to be lethal. Doctors tell stories of witnessing patients lose lives as they failed to triumph over life-threatening ARV side effects. These side effects become deadly if those dispensing the drugs lack the skills to diagnose them in time. Although this is the reality, some of the doctors do not want to speak openly about it for fear of creating panic. Life-threatening side effects occasioned by the ARVs was lined up for discussions at the upcoming International Conference on AIDS and STDs in Africa that was to be held in Abuja, Nigeria that December. I was never able to find any proceedings from that conference because I was curious to see what they actually talked about. It's important to realize that prescription drugs are dangerous materials. Every year, prescription drugs used properly kill 100,000 and injure over 2 million Americans, making these reactions between the fourth and sixth leading cause of death in the United States. The Centers for Disease Control tell us that 96% of HIV-positive Americans are taking antiretroviral drugs. Now, the antiretroviral drugs, the anti-HIV drugs, are far more toxic than your average prescription drug. Severe hepatitis has been reported with all of the currently available classes of antiretroviral drugs, in other words, all of them. So it's not surprising then that liver failure has become the leading cause of death among HIV-positive Americans. And liver failure is not one of those AIDS-defining diseases that the CDC is putting that long list. AZT was the first ARV. It's a nucleoside analog. Peter Duesberg here ordered a bottle of AZT from Sigma Chemical Company, and you see this little Jolly Roger up here that's on the label, and the warning label reads, toxic by inhalation, in contact with skin, and if swallowed. Target organs, blood, bone marrow. If you feel unwell, seek medical advice. Show the label where possible. Wear suitable protective clothing. Now, if you're HIV positive, your AZT comes in a bottle that looks like this. No skull and crossbones, no warning to wear suitable protective clothing, etc., etc. The nucleoside analogs are the backbone of the ARVs. They're still the backbone. Usually two of these guys are in the combination that people take. They were developed in the 1960s as cancer chemotherapy. They are cytotoxic, which means they're cell poisons. They're designed to kill dividing cells. AZT was never used as cancer chemo because it was too toxic. Therapeutic index was just too narrow. The therapeutic value and the toxic value were so close that they didn't use it for chemotherapy. A doctor who prescribes nucleoside analogs for life to a cancer patient would be guilty of malpractice and probably lose his license. But if you're HIV positive or have a Bangui disease, the standard of care is to treat you with these drugs for life. Here's just a short list of some of the diseases, including death, that are caused by the antiretroviral drugs. These on the left include AIDS-defining diseases, immunodeficiency, leukopenia, fever, and so on and so forth. And over here we have other diseases that are not on the CDC's AIDS-defining list. And then there's the hepatitis that we're talking about, which kills a lot of HIV-positive Americans and other people as well. So you might ask, given all those bad things about the antiretroviral drugs, aren't the HIV drugs worth the risk? There is not a trace of scientific clinical evidence that the antiretroviral drugs save lives. How do we know this? Well, the drug companies tell us. The prescription information that comes with Glaxo's Xiagen, for example, says this. You can lay your hands on it and you'll find this in there. At this time, there is no evidence that Xiagen will help you live longer or have fewer of the medical problems associated with HIV and AIDS. Merck's protease inhibitor Crixivan is no more encouraging. It says it is not yet known whether Crixivan will extend your life or reduce your chances of getting other illnesses associated with HIV. Boehringer Ingelheim's Viramune, which Africans know better as nevirapine, says this: at present, there are no results from controlled clinical trials evaluating the effects of Viramune on the incidence of opportunistic infections or survival. And then we have Glaxo's Combivir, which is a mixture of two antiretroviral drugs, and it says there have been no clinical trials conducted with Combivir. Believe me, I was in the pharmaceutical industry for a long time. If there was even a shred of evidence that these things would promote life or improve the quality of life, they would be plastering that everywhere. They would not have that in here. Okay. AIDS peaked in the USA years before the availability of so-called highly active antiretroviral therapy became available. This is the Centers for Disease Control data. You can see that AIDS peaked around 1992. Here's years down here. Years before, as I said, the appearance of HART, H-A-R-T, which is shortened to ARV these days for antiretroviral drugs. And the important thing to notice here is that there was a natural decline in AIDS and AIDS deaths prior to the appearance of these antiretroviral drugs, these combination drugs. But even more sinister, I guess, is notice that within months after the appearance of these ARVs, the natural declines in AIDS and AIDS deaths stopped abruptly. This is exactly the opposite of what you would expect if these drugs were actually promoting health and reducing mortality. In fact, the CDC's own data makes a strong case for the fact that the antiretroviral drugs are very dangerous things. They're causing AIDS and killing people. I'm showing you the next few slides information from the CDC's HIV/AIDS surveillance report, year-end edition for 1997, and note that this is volume 9, number 2. The reason I'm showing you this is to let you get a glimpse of some of the deceptive practices that the CDC has been known to participate in over the years and been documented by the Atlanta Journal, the Wall Street Journal, and other places. You see here, they mark the 1993 definition change on here, and there's a peak in the AIDS cases. These little diamonds here are supposed to represent, they want you to think they represent, actual AIDS cases that the CDC counted on a quarterly basis from 1985 all the way through 1997. So that's supposed to look like real data. Now if we go to page 25 of volume 9, number 2, we see the real data. This is really what happened there. Here's 1987 up to 1997. You see a very slow increase on a quarterly basis of AIDS cases. It looked like they're leveling off, reaching a plateau in 1991-92. And then, of course, you see this huge spike, which is due to that definition change, 1993 definition change. And from the last quarter of 1992 to the first quarter of 93, there was a threefold increase in AIDS cases. But even with that boost, with this 1993 definition change, there was a dramatic drop in the number of AIDS cases on the order of months here. And it did level off as before, but notice that the background level now is above what it was when it peaked in 1992, right here around 93. The question is, what are these up here? Are these new AIDS cases that the result of the 1993 definition change? Well, we're going back to other information from that same volume 9, number 2, 1997. 1997 was the last year that the CDC published the distribution of AIDS diseases. They don't do it anymore, so you can't break it down. There's about 5 different definitions of AIDS. And the CDC has a rule. You always come under the earliest definition of AIDS that you qualify for. Now, the important thing here to notice is that they include the 1993 definition change, which is a non-disease category. 61% of all the new AIDS cases, full-blown AIDS cases according to the CDC definition, 61% in 1997 had no symptoms of disease. They had the results of 2 laboratory tests. They had antibodies to HIV, and they had fewer than 200 CD4 cells per microliter of blood. Had they had any one of the AIDS-defining diseases, they would not have been put up here. They would have been put down here, depending on the disease that they had. Now, remember, we used to talk about AIDS. I still do. But if you read the newspaper, I've heard lots of people in here today talk about HIV/AIDS. Well, HIV/AIDS was concocted to conceal the fact that since 1993, well over half of all new AIDS cases are disease-free. If you're HIV positive, people will call you HIV/AIDS. They'll say HIV/AIDS just because you have a positive antibody test, even though officially you have to also have fewer than 200 CD4 cells per microliter of blood. But you can see how you can play games with these things. To hide the fact that the ARVs cause disease and death, they came up with a new disease, immune reconstitution syndrome, or IRS. IRS, by definition, only appears shortly after you start taking antiretroviral drugs. That's the definition, one of the definitions of IRS. Recall that if you have any of these diseases right here, Kaposi sarcoma, TB, cryptococcus, and so on and so forth, and you have antibodies to HIV, you're an old-fashioned AIDS case. Now, interestingly, if you come down with the exact same diseases, absolutely the exact same diseases, but they only show up after you start taking antiretroviral drugs, you're no longer suffering from acquired immune deficiency syndrome. You are suffering from acquired immune reconstitution syndrome. In other words, you get these diseases from a depressed immune system. You get the exact same diseases from an improved or recovering immune system. So if you're HIV positive, you can't win. You know, there's no way. It's a rigged game. So if you think this is perplexing, you're not alone. Bill Powderly in Dublin asked, what is one to make of the long list of AIDS-defining diseases cropping up shortly after a person starts taking the antiretroviral drugs? Is it immune reconstitution syndrome, AIDS, drug toxicity, a new disease process? What's a doctor to do? Stop or continue the ARVs? Stop or change opportunistic infection therapy? Add immunosuppressives? You can see it's very, very difficult to do when the diseases are identically the same. Here is the latest list, compilation of the diseases that identify IRS, or immune reconstitution disease. And for those of us who've looked at the CDC's HIV/AIDS surveillance reports over the years, you see this list, you say, my God, that's AIDS. Here is just a short list from, I have a huge, huge list. Immune reconstitution syndrome is a massive problem, absolutely massive. There's whole conferences devoted to it. I do PubMed searches almost daily. And almost daily, there's at least one or two papers on immune reconstitution syndrome. There's hundreds of these things. And here I've just put down here some from 2008 up to just very recent. Typically what you see in papers that talk about immune reconstitution syndrome, they say 25 to 30% of people who start taking the antiretroviral drugs come down with an AIDS-defining disease within weeks of taking the drugs. Now, there's this one at the very top. Now, you see these percentages here, though. I mean, up to 50%, 66%. You know, those are major fractions of a population of people taking these antiretroviral drugs that come down with these AIDS-defining diseases. Now, this one here, I got just the other day. It's brand new, doesn't even have page numbers yet. It was a study conducted in Mozambique where 12% of the people who started taking the antiretroviral drugs came down with Kaposi sarcoma within 14 weeks after they started taking the drugs. Just Kaposi sarcoma. That's only one of the diseases. So that's an astounding thing. I mean, that beats poppers. I don't know how long it takes poppers to do it, but that's an amazing thing. Now, the one in green here, I want to talk about in a little bit more detail. It's exceptional report. They looked at 498 patients who experienced 620 adverse events after they started taking these drugs. This is what makes this study unique, is that they're talking about all the adverse events, not just the IRS events. They decided that among these 620 adverse events, 23 to 41% of those were immune reconstitution syndrome. How they came up with that, it's not even important right now. But you can see that IRS is a tip of the adverse event iceberg. They use this data to come up with the sixth definition of IRS. They keep coming up with new ones all the time. I think there's only 5 definitions of AIDS. Now we've got at least 6 IRS and counting. And don't worry about this details. This is gobbledygook right here. It's just a lot. It looks like it's, you know, my God, I'm supposed to remember this. I'm supposed to be able to use this to sort out what IRS is. Well, it takes a lot of work to avoid recognizing the obvious. That immune reconstitution syndrome is drug-induced AIDS. That's what it is. That's why they have to go to all this trouble here, all these different definitions, to do everything they can to make IRS a separate entity from AIDS. As I said before, the communication system in Africa is very, very good. People know what's going on. And they see what's happening to themselves and their neighbors, and they spread it like wildfire, the information. The Treatment Action Campaign in South Africa realized they had to do a bit of damage control because of what people are seeing with their own eyes. So they put these words in this young man's mouth. I got sick with TB after starting ARV treatment because the TB was sleeping in my body took a chance to wake up as my immune system began to recover. I mean, if you buy that, you know, TB is when your immune system goes down. Now he's saying TB is coming back because my immune system is recovering. I don't know how many people buy that, but that's what they're putting out there. And I'll conclude with this. It has never been shown that adults or children or fetuses in the womb taking the antiretroviral drugs live longer or at least better lives than a similar group of people not taking the drugs. On the other hand, there is ample evidence that the ARVs cause AIDS-defining diseases and death. And that is it. Thank you.